in this together, and you have demonstrated clearly that you will fight with us jointly as we work to defeat this pandemic. So on efforts, it's been great. None of us are perfect, not even I, nor is the governor. We might not always do the exact thing that's right all the time, but as long as we're making a continuous effort to work together to beat this pandemic so that we can get our people back to work, back to a normal life or some sort of a normal life, because life's changed as we know it as a result of this pandemic. Let me just say that it's fitting that we're here on this corridor, on the 6th Strong corridor in the zip code 33311. And by the way, it is a zip code in Broward County that has the second highest number of people who have tested positive for the coronavirus. This community is often underserved, yet it's a place where many of the pioneering leaders of Broward County, particularly those who are of African descent, originate from. We're on this corridor, the Sistrunk corridor, named ably for Dr. Sistrunk, who started a hospital right here, Providence Hospital on this boulevard, at a time when blacks were not allowed to go to Broward General. It's a different time and it's a different day. Our community has come together in a serious way to ensure that we're working together to fight this deadly virus. We are the place, the Urban League of Broward County, a champion organization led by a great leader that works to ensure that those who are underserved are given the services that they are needed. Dr. Ball, I thank you and I commend you for your efforts and the organization here. Now, Dr. Tachi, you got some heat early because folks were complaining you weren't giving us all the information and all the data that the press wanted and we wanted, but you were steadfastly working to ensure that Broward County was at the forefront of testing, of tracing, of ensuring that people who are positive are isolated so that we could contain the spread. And your effort is paying off, because at this time we're flattening the curve. What we have to do now is look forward to how we can plan for the future, because our economy cannot sustain where we are. Our small businesses are still receiving notice that they haven't paid their rent. Many people who are out of work will get some assistance, but it won't be enough for them to live a full, prosperous life. So we have to now start to look at how we continue to fight and beat this virus, but also how we plan for the future. A different time with different plans, because we are all not going to be able to do all the things that we'd like to do. I love to shake hands. You notice I can't shake hands that much anymore, right? The masks make me a little uncomfortable because it makes me sweat a little bit more. But this is what we must do in order to beat this virus. And I look forward to the day when we can all work together again to ensure that we're working diligently to provide prosperity for all the people of this community. Again, thank you, Governor. And thank you, Director Moskowitz. Dr. Ball.
Good morning. I welcome you and each of you to what we call the Empowerment Campus, which is Samuel Delaveau Park, the African American Research Library, and the Urban League of Broward County. When we cultivate relationships in time of calm, we're able to activate them powerfully in the time of crisis. And that's why we stand here today. I thank you, Governor DeSantis, and your team for your continued partnership with the urban leagues across the state of Florida and expanding coronavirus testing and options in our community. We absolutely need this now. To our local leaders like Gino Santorio, CEO of Broward Health, I thank you and your team for standing up the drive-through testing site at Central Regional Park in partnership with our Broward Sheriff's Office, our City of Lauderhill, and Broward County Parks and Recreation. From there, we were able to answer the call once more with Dr. Tachi, which Mayor Holness talked so beautifully about, because she works tirelessly leading our Florida Department of Health in Broward County, and also our National Guard for your assets and the state funding to be able to manage these two sites in Fort Lauderdale and Pompano. Like the Florida Consortium of Urban League affiliates, there are many existing networks who are willing to partner, willing to make a difference, like the Florida State Medical Association that represents over 2,000 Black doctors across the state of Florida. It is unfortunate and a painful fact that this coronavirus is killing African Americans at a greater rate than any other group across the nation. But I will tell you this. We do not want Florida to reflect the nation in this way. That's why the governor's support and what he is doing here today, and the Office of Minority Health and the Bureau of Chronic Disease Prevention, and using models of social determinants of health is so important for us now, and is going to be imperative for us in the future. This virus is no respecter of age, race, ethnicity, income, or geography. It does not discriminate, and we must speed up every effort we can to test and to educate, to be able to prevent the spread and the deeper penetration of this disease in our community. We know that one way to reverse this is various access to testing, like we're doing today in Pompano, and we will be doing tomorrow here at the Urban League. That is how we're going to slow this disease and hopefully end it in the time to come. Testing is one way, and the other way is education and awareness. Across the state of Florida, my colleagues, the 7 urban leagues in the state of Florida, we have been working tirelessly to communicate to our community and get the word out to tens of thousands of individuals that we must stay safe. The Urban League stand ready to support any and every institution in this fight. We expect to use our people and our physical assets to keep our communities moving forward, now and absolutely in the future. So to my fellow neighbors, I'm speaking directly to you. I pounded this drum not because of some profound policy discussion around a round table, and I'm thankful that those with the resources heard it and actually did something to respond about it. I pounded this drum related to a walk-up site because, like you, I would have been the child of a family who would have needed this type of access. My parents used public transportation, shared rides to and from work, and yet simply walking. So despite the titles that I might have today, I will always be that little girl from a family just like yours that needed to have this type of service. But now I need you to do your part. I need you to stay at home if you can. And if you have to work, I need you to stay safe and use every precaution you can. I need you to manage your health. Whatever the underlying conditions are, let's manage it together. I need you to use these testing sites, whether it's the walk-up or the drive-through, if you're having any symptoms. I need to see you on the other side of this Jordan. We will make it home, I promise you. And when we do, I want you to come by and say hello here at the Urban League. Thank you, Governor.
Well, thanks so much. It's really exciting to be able to expand this and to reach as many people as we can with the testing. Just so everybody knows, as we get into the next phase of this, we actually are going to probably be doing even more testing. And part of the reason for that is there's going to be a diagnostic need. If you have a business and somebody may have a symptom, what you want to do is have an easy place for them to go get a test and then get a result in a decent time interval. And then obviously when you're talking about hospitals, somebody comes in, they're doing this in many places now, Cleveland Clinic, other places with these rapid tests where they can know immediately if someone's symptomatic, whether they're COVID or not, and if they're not COVID, then obviously you're going to deal differently. But then even the asymptomatic people, when they're coming in, they're able to identify because an asymptomatic person can spread. So we're already working on ways to be able to expand the capacity even more. Because you have things like these rapid tests coming online, that's a great thing. What that has done is it's made a little bit more space in some of the lab testing. So the lab testing, if you can get that turned around in 24 hours, is a huge tool. I think part of the problem that we've seen around the country with LabCorp, Quest, some of these, is they just have such a big backlog that people don't get the results immediately. So you'll have, hospitals will have their own labs still. They can do a certain amount of tests. You'll have the instant tests, which certainly for hospitals, first responders, nursing homes and assisted living facilities, very important, particularly for the staff to be able to know there. But then beyond that, having quick lab testing is something that's very important. So we're working on things in the state of Florida to be able to meet that need, because I think if people are able to have access to a test, even if you do have somebody that tests positive, you can, because of public health folks, they can trace the contacts, isolate, and really contain this. But you got to have the tools to do it. I will also say this. When this first started in Florida, a lot of throughout the country, what we were doing here in other places is we'd have to find somebody, you administer this swab, and then you'd send it to the CDC in Atlanta. And then you'd wait usually a week for the results on that. And that made it a little bit more difficult to do. They let us start doing the state labs, which are limited in what they can do, but you would still do some through the state labs. But what we had in our county health departments was a very strong effort at isolating people that tested positive and then tracing the contacts. So you look in different places. Well, Broward, even though they've had a lot of cases here, you would have had way more cases if it weren't for the work that they were doing here at the health department. You look around the state, we have counties that have hundreds and hundreds of thousands of people that have very few cases relative to the population. Some of these counties have 500,000 people. They got like 150 or 200 cases. And part of that is because of different types of social distancing, but part of that is because what these county health departments were doing to isolate the contacts, isolate the sick, trace the contacts, and limit the spread of this thing, which is kind of the bread and butter of public health. So we are now going to be in a situation, we're going to have even more resources at the disposal to do that. And I think the success that's happened has been an unsung story here in Florida in terms of what they've done with isolation and containment. That's going to then take on even added importance, and we're going to have the ability to do that. So with that, I'm happy to take a question or two.
Private tests, you mentioned that the private tests kind of have this backlog. Private labs are doing 90% of testing. Why hasn't the state reported that backlog?
So this is another totally fake narrative. If you go to your doctor's office and the doctor swabs you and sends it to LabCorp, the state doesn't know that happened. It's only reported when you have a result. So this disease and other diseases, when you have a result, it's required to be reported to the state of Florida. There's no legal requirement for them to report the fact that they just swabbed somebody. So it's not like we know the total number of tests. We don't. We don't know how many. In fact, if we call some of these test centers, they can't even give us the proper things. And so I've been very clear from the beginning, we expect another 15,000 results tomorrow, 10,000. When I give the total test numbers, I always say we're probably going to hit another 10,000. Of course we know that there are tests out there, but it's not reportable until they actually have a result. And so you have private hospitals that are sending the LabCorp. You have test sites that are sending. Some of the sites we're supporting. Some of the sites we provide the materials, but other folks run it. The Jacksonville site, City of Jacksonville, Fire Rescue, they've done a great job. So it's not the case that somehow the state is just sitting on this. And California had the same thing, where they had 60,000 test results dumped from the private labs about a week and a half ago. So we know that there are tests out there, but they're not required to be reported to the state of Florida until there's actually a result.
Are you going to grant immunity for the health? Are you going to grant immunity for the nursing homes and the long-term care facilities like the Florida healthcare system?
We're working on it. We'll have an announcement on that. I haven't decided yet. Yes, sir.
Can you talk about the logistics of the operation, the walk-through operation, and how you will make sure patients are adhering to social distancing if they're behind rooms outside? And also, what are the operating hours as well?
Who wants to handle that? Is that anyone, you want to answer? Yeah, go ahead.
The hours are from 9 to 6, And we have set the pod up so that there is adherence to social distancing. Everybody who comes will either be wearing or will be given a face covering, and we've actually marked out the line so that folks are at least 6 feet apart.
Governor, talk about the reopening. There's so many more cases in places like Miami and Broward.
I'll do you next. Yep, go ahead.
And then, as you mentioned, some of the smaller counties, much less cases. So will it be easier to hope?
One, I mean, we actually have huge counties, not as big as Miami-Dade, some that are close to Broward, not quite as big, but if you look at places like Orange County, Hillsborough County, Pinellas, Duval, these are 900,000, a million and a half people, and their caseload is just a lot less than you have in Palm Beach and Broward and Miami-Dade. And so